A surgical technologist is a specialist in instrumentation, a queen or king of aseptic technique. They are the cops of sterility in the operating room, and they are the surgeon's right-hand man. A good tech is one who can anticipate what's going to happen in surgery and one who can react without stress. We are there for the patient. We protect them. I think that's really cool.
What our students learn impacts the patients at a very basic level. They don't just pass instruments, they're also a patient advocate. Mistakes can lead to numerous complications, including infection, additional surgeries, a misdiagnosis, or ultimately a patient's death. They're a very critical component in that operating room team.
In this role as a surgical technologist, I am serving the surgeon and I am providing care to the patient. I'm here for you and I'm going to keep you safe. It's crazy stressful, but I understand why. If we mess up, that one microbe that got on that one thing could give a hospital-acquired infection to that patient. That is a huge responsibility on a person who wouldn't take that seriously.
The patients are the heart of what we do. That's why we're there. I really do feel like I'm guiding them through the process of learning how to become a tech. I think it's a pretty great environment for students. We're very aware of a lot of the challenges that students face. There's a lot of support and opportunity to get the kind of help they need to stay in school, be successful. There's a lot of shared information within the community.
I had doubts about vocational colleges. I did not expect the instructors to be so dedicated to our success. We have instructors who will tell us about industry, tell us secrets. They celebrate your small victories. It's really cool to see them so dedicated to our education.
We talk a lot about the doctor and meeting the needs of the surgeons, but we're there for the patient. We're there to get those people back to their loved ones. The most exciting part about teaching is that moment when it clicks and you see the light bulb come on behind their eyes and they get so excited because they know they got it.
There is a whole lot of pride in this program. The lessons that you learn, the camaraderie, and the idea that you can make a change. You're going to be standing 6 inches away from a surgeon. It's really cool. The significance of what we do in the OR. Who wouldn't want to do this job?